really need better access to health. Our health system as it is does not serve our people very well.
How is that going to translate over to the next generation to be hopefully a diabetes-free generation?
First Nations Indigenous communities in British Columbia, the westernmost province of Canada, are often too remote to receive the medical support they need. Access to healthcare specialists can take days, and people who are ill can be in hospitals long distances away from their families for long periods.
So we do know that diabetes is disproportionately represented in Indigenous communities. Often in remote communities, when someone is diagnosed with diabetes, they don't have access to the education they need, or sometimes don't have somebody to help answer their questions around certain types of medications, including the benefits or side effects.
BI knew they had to help. It all started in 2018, when Chief Isidore Day, the Health Minister for the Assembly of First Nations in Canada and founder of Bimaadzwin and Boehringer Ingelheim Canada, started talking. These conversations led to an innovative partnership. Led by Indigenous communities, Pathways is a collaboration between Bimaadzwin Indigenous health policy leaders and Boehringer Ingelheim Canada. One of the Indigenous peoples involved with Pathways is the Nuu-chah-nulth community. BI have the same goal as the Nuu-chah-nulth, to create a diabetes-free generation. By educating communities on how to manage the disease and creating new pathways through technology to enable access to specialized care for type 2 diabetes, they are making strides to achieve this goal.
At Boehringer Ingelheim, we wanted to make a difference in outcomes for Indigenous people. Canada does not have a formal Indigenous health policy, and as a result, we worked with a team of Indigenous health policy advisors to develop the Indigenous health policy framework.
The purpose of the Indigenous health policy framework is to provide a set of tools that contribute to innovative collaborations between partners that are interested in helping to close the Indigenous healthcare gap in Canada.
All of our partnerships with the Indigenous communities are pharmaceutical agnostic. They have to be focused on meeting the healthcare needs as identified by the community. We engaged the Indigenous communities through Bimaadzwin and through the Indigenous health policy experts to better understand what their needs were and how we could support them to address the needs to optimize healthcare services within the community. We spent 3 years listening to Indigenous leaders, Indigenous voices, informing, educating us. And so it gave me an appreciation of what some of the Indigenous communities within British Columbia are facing. And when that project came through from Nuu-chah-nulth, it really made me happy that to see how Pathways was able to serve the needs of a community identified as severely lacking optimal access to health services.
There are 14 Nuu-chah-nulth nations, and they span 300 kilometers on the west coast of Vancouver Island. Our vision for diabetes support in all the Nuu-chah-nulth nations is offering every person living with diabetes who would like it access to an endocrinologist or diabetes specialty services.
The Nuu-chah-nulth project brings together technology and a dietitian who is within the Nuu-chah-nulth community to optimize care for the patient.
I find that empowering community members with the knowledge on how to adjust their own insulin has made such a big difference in their overall blood sugar management.
We've had stories of patients within the pilot sites that have had their lives changed, turned around, and to see where they are now, once again going back to what they used to enjoy in life.
Paul is one of the patients the pilot helped.
I've been doing really good, and I used to have a hard time just walking, not even half a block or anything. But now I can walk for miles.
This is really why I'm passionate about this work, and this is why I get so much joy out of people coming out the other side with their diabetes and transforming their lives and feeling better and teaching the next generation on how to do that. But empowering people with that knowledge is important.
It takes time to do it the right way. Our Pathways has been a very fulfilling journey. It has instilled a purpose in what I do. The impact it has had at Boehringer Ingelheim is that it has raised the level of understanding within senior leadership, not only in Canada, globally as well. It has been a fantastic learning experience.
This is not a one-off story. BI Canada continues to partner with the Indigenous communities to transform access to healthcare in a sustainable way for future generations.